most of these closed loop systems we see is the nighttime readings, because there's really no human interference in regards to eating, exercise, and activity, and so the pump does its things, what it's supposed to do, and you can see the best improvement usually in nighttime glucose readings. So the red is the closed loop system, and this is the control group, and as you can see, the time and range improves in the closed loop compared to the control. Now coming to the Medtronic 780G, which is hopefully available soon in our center. It's approved for the patients from the age of 7 to the age of 80. It does have a set target for glucose, so 100, 110, 120. And in that, anxious patient where they don't feel comfortable with a blood sugar that's 120, it might not be the ideal pump for them. So choosing a pump that has adjustable glucose targets and flexible targets might be a better option. There is a temporary target of 150, but it has to be set for a certain amount of time, and then automatically it will go to the other set targets. The manufacturers have done a study on different targets and different active insulin time, and the best time in range and best A1C reduction occurs if the patient set the target for 100 and the active insulin time to 2 hours. You might think that increases their risk of hypoglycemia. There is a slight increase of hypoglycemia that was not significant, but it definitely improved their time in range. You do enter basal insulin settings because the pump will kick out the patient from auto mode if they have sustained hyperglycemia for a certain number of hours. If they do not calibrate, and that's one of the drawbacks currently, is that they have the Guardian 3, which requires 2 to 3 times calibration, which might be, a deterrent for some of the patients. So if they do not calibrate, they will be kicked out of the auto mode, put in the manual mode based on whatever basal settings you have put in, and it will function technically like a 640G. And so hopefully Medtronic has gotten approval for infusion sets that last 7 days. Currently, they're not available here. We still have the 3-day infusion sets, and hopefully the Guardian 4 sensor that does not require calibration will be coming also soon to our region, and that will be a big advantage, because if the patient is required to calibrate, they're more likely to go into the manual mode rather than the auto mode, and it's just human nature that we see the